Hey everybody, welcome to class this week. So it's been a couple of crazy days for me, I'm not gonna lie. I've been closing on a house. My wife and I were finally able to buy a house in the area, so I'm no longer commuting an hour and a half each day, each way. It's beautiful. And we've just had a lot of stuff going on with moving, so I apologize that this video is probably going to get uploaded on Tuesday for you guys rather than on Monday like I normally do, but it's how it goes. Some of it's just life. You guys, I went through and looked at tests, and everybody looks like they at least started off doing pretty well. It's awesome. Give me about 10 days or so to get your tests back. It takes a lot of effort to get through some of these tests, and I had a test in every single one of the classes I teach. So I promise I'll get back to you guys. Give me like 10 days or so before you start asking questions about when the test's going to be graded. Because of the way that we did the test last week, I wanted to make sure that you guys were able to focus exclusively on that test and not feel like you were overwhelmed. It kind of put us about a week behind, so we're going to try to play a little bit of catch up. We're going to do 2 modules this week, we're going to do 2 chapters this week. Next week, we're going to do another 2 chapters, and that should catch us back up, and we should be on pace to finish the semester out perfect. I just wanted you guys to be able to just focus on the exam, and I knew you were getting crushed in other classes, so hopefully it worked out. Hopefully you did well on all your exams that you had last week, not just mine. And yeah, so this lecture is going to be focused on the shoulder girdle specifically. So realistically, the major emphasis point of the shoulder girdle is that it is going to serve a mission critical aspect to all of our upper extremity movement. If you think about it, the shoulder girdle is playing a role in all of our upper arm movement. Now, what is it exactly that separates the shoulder girdle from the shoulder joint? We're going to talk about in this lecture because we're focused on the shoulder girdle essentially. The next lecture is really going to focus more on the shoulder joint. Most of you guys are probably like, what the heck? These are 2 different types of things. These are 2 what? Don't worry, it's going to make sense, I promise. Today we start really driving through some of the muscles and tendons and origins and insertions that are going to be driving a lot of our movement. So in order to talk shoulder girdle, let's first talk skeleton features, right? Like let's talk bones, let's talk our structure. That way we can kind of start to put it all together on what is going on where. So if we're thinking shoulder girdle, we're realistically going to be talking about the scapula and the clavicle. These 2 bones are going to be moving as a unit, and the clavicle is going to actually articulate with the sternum. That is going to be the only physical linkage between the shoulder girdle and the axial skeleton. It's going to be where the clavicle ties into the sternum at that sternoclavicular joint. So that's what this major, the massive arrow, in case you were wondering, is actually pointing to that sternoclavicular joint. So this point is realistically the only bony attachment site in all of the shoulder girdle, right? Because if we wrap around from the clavicle onto the scapula through the acromion process, there's never really any other bony connections, right? The scapula is essentially floating on our back with musculotendon like attachment sites, but it's never going to interface bone to bone. It kind of free floats, right? So this is the only sternoclavicular joint is the only shoulder girdle bone to bone, good lord, bone to bone interaction site. Now, just to kind of orient you guys, this slide and the next slide is going to have like a little highlight to show which is the right side and which is as we're rotating through these 2 pictures, right? So if we're looking at it from this side of things, we're going to be looking at this from the anterior view, right? We're going to be looking at it anterior view in an anatomical position. So this is going to be the sternum, the manubrium of the sternum, right? Smack here, right? Then we're going to have our collarbone or our clavicle, and then we're going to reach all the way back around and actually be seeing the scapula as well. And that's why you're going to see this glenoid fossa right here, is because this is the anterior view of the right-hand side. So what are some of our key bony landmarks? What are some of the key sites of bones that we really want to be paying attention to with the shoulder girdle? First one, we want to be paying attention to the manubrium, right? Because it's the major part of the sternum where the clavicle is going to be tying in. Obviously, the other major bone that we want to pay attention to, if it's the sternoclavicular joint as the primary bone-to-bone interaction is we want to pay attention to the clavicle, right? So the clavicle is going to be sitting right here, and it's a flat bone, and it's where we're going to basically connect the sternum all the way through, or the sternum all the way through to the scapula, right? Other major bony feature that we want to pay attention to, another major bony feature that we want to pay attention to is going to be the coracoid process. And that's going to be this process that's coming off of the anterior side of the scapula, which is located right here where I'm circling with the cursor. Another major thing that we want to think about is the acromion process. And that's going to be a key site of interaction between the scapula and the clavicle, because we're going to have the acromioclavicular joint, which is where the acromion and the clavicle, or the scapula and the clavicle, are actually going to be interfaced or interacting. We're going to have the glenoid fossa, right, which is right here, and that's where the head of the humerus is going to be sitting in, and this is why it's a kind of like a T, or a golf ball sitting on a T. If you hear about that in anatomy, or when you're kind of Googling some of these things, you'll see that often the humerus is referred to, or the shoulder joints are referred to as a ball sitting on a T, and it's a very shallow cavity, and that's where the head of the humerus is going to be fitting. You're going to have the lateral border of the scapula, which is going to be located here. Now think back to our anatomical terms. This is why it was so important that we nailed those things. The lateral border is going to be the outside border of the scapula. You need to pay attention to this because where things insert, where muscles insert, is going to drive the action of the scapula. The inferior angle of the scapula is going to be down here all the way at the bottom, and then that medial border is going to be towards the inside of the scapula. Let's flip it around and let's look at everything from the back now. Just like we had, we're going to flip around and we're going to see that we have the right side again, but this time it's actually going to be the right side of your screen. Couple key bony landmarks. Again, we're going to have the acromion process, right, where the clavicle interacts with the scapula. We're going to have the lateral border. This time it's still on the outside, but it switched sides because we've changed views. The inferior angle is still down here. The medial border is still over here, but it's just reoriented because we're looking at it from the back now instead of from the front, or posterior instead of anterior. Now our superior angle is going to be all the way up here at the top end side. You can see it from the anterior side, but it just kind of hides behind the clavicle some. And then we're also going to have the spine of the scapula right here. And now these things are important because if you know the anatomy of the scapula, and then we learn the origin and insertion sites for the various muscles that are going to control the scapula, which you're going to be required to do, it's going to help you visualize the motion of the scapula that's going to be occurring based on the fact that we know that insertion moves towards origin in muscle contraction. So one of the most important joints that we should know when we're talking about the shoulder girdle is going to be the scapulothoracic joint. Now I want you guys to just hold with me. We're going to talk about this joint in a couple of slides because it's so important. But realistically, this is not a true synovial joint. The primary motion that's going to be occurring here, the primary movements that are going to be occurring here, is how the scapula is going to be moving and rotating and sliding and gliding along the back of the rib cage. Now, the sternoclavicular joint, we talked about it a little bit, but I want to talk about this a little bit more, right? So let's think about how much movement can actually occur at this joint. If you think about it, go ahead and place your right hand right over top of where your left clavicle inserts onto, or not inserts, but right on your left sternoclavicular joint. And I want you to actually take and elevate your shoulder. Now, do you feel how you actually have clavicular motion? That's because it is a joint. It's something that you wouldn't normally think about, but it is actually a joint that's capable of at least a decent amount of movement, right? So when it comes to the sternoclavicular joint, in the anterior movement, right? So if we're protracting, if we're rolling our shoulders forward and bringing that left shoulder forward with our right hand still on, you can feel that clavicle is actually moving forward. It's moving forward about 15 degrees. Now, if we take and flip that, and you go through and you retract your shoulders, and you pull your shoulder blades closer together, you'll feel that that clavicle again moves backwards. So that's actually a posterior movement, right? And again, it's about 15 degrees of movement. Now, if we take and we elevate, if we abduct our humerus and we actually let ourselves hike up that shoulder some, you'll feel that that clavicle goes up about 45 degrees, right? So if we think 90 degrees, 45 would be somewhere in the middle-ish, right? Real-ish. You can feel that clavicle actually elevate about 45 degrees. Now, if you try to kind of depress that shoulder, I hope you guys can see what I'm doing, otherwise I look like an idiot in this room by myself. If you try to depress that shoulder, you're going to get about 5 degrees worth of movement. Some people might be more, some people might be less. This is average movements. You're also going to have some slight gliding movements that are going to occur here. When it comes to ligamentous support, you're going to have the sternoclavicular ligament that's going to be providing the anterior support, as well as the posterior sternoclavicular ligament that's going to be providing the posterior. Then you're going to have costoclavicular ligaments, as well as interclavicular. Oh my gosh, I can't talk. You're going to have the interclavicular ligaments that are also going to provide some stability around that joint to really help make sure that we're maintaining joint stability. Now, our acromioclavicular joint, or our AC joint, as it's more commonly called, is going to be an arthroidal joint, and we're going to have about 20 to 30 degrees of total gliding or rotational motion that's going to be occurring. This is going to accompany both shoulder girdle and shoulder joint motions. This one's a little bit harder to feel the motion of it. I mean, you can kind of feel somewhat if you allow yourself to like abduct and then internally rotate, and you can feel that kind of sliding or that gliding motion, that rotational motion about the shoulder, because essentially what you're doing is you're allowing the scapula to wing up, or to actually go into like an anterior tilt. These are going to be supported by the corticoclavicular ligament, the superior acromioclavicular ligament, and the inferior acromioclavicular ligament. AC joint, the reason most people are familiar with this name is that it is often injured. You'll see this a lot of times in people that bench press. Overhead athletes see AC joint separations pretty often. Realistically, if you're an athlete, you know someone that's separated their AC joint, and this is exactly where it is, right where the clavicle, right here, ties in to the scapula, so right on the top of the shoulder. You can actually get needle injections into the AC joint. Crazy. All right, so now the big mama, right? The scapula-thoracic joint. And remember, a couple slides ago, I told you it's not a true synovial joint, and that's complete honesty, right? It doesn't have regular synovial features, right? So it doesn't have the synovial fluid. It doesn't have any of that. However, it does allow a pretty good amount of movement about that scapula-thoracic joint. So it's going to depend on the sternoclavicular joint and the acromioclavicular joint. Those two joints are going to allow the scapula to either rotate or to move superior or inferior, right? So all of the movement of that scapula is going to be largely driven by the clavicular, the sternoclavicular, and the acromioclavicular joint, because if we don't have movement there, then we don't have a ton of movement of the scapula. When it comes to scapular movement potential, we have about 25 degrees of abduction or adduction, moving the scapula away from the body or back towards the midline, right? Away from the spinal line or back towards the spinal line, away from the vertebral line or back towards the vertebral line. You're going to have about 60 degrees of upward or downward rotation, and you're going to have about 55 degrees of elevation or depression. So this one's going to be a little bit goofy, but I want you to do your best. If you're like me and you have no range of motion in your shoulders, it sucks, but I want you to try it anyways. I want you to actually take, and almost like you're trying to wash your back, I want you to try to put your right hand on your left scapula, and I want you to feel how much it rotates. You feel how, if you go into this abduction, you're going to get a fair amount of rotation about that scapula. And that's good. That's normal. If you put your hand back on and you also elevate and depress, right? Shrug and drop your shoulders, shrug and drop your shoulders. You're going to get about 55 degrees of elevation and depression that's going to be occurring at that scapula. Just like we did on the first test with different types of contractions, you're going to have to put your hands where the joint is trying to move so that you can feel it and try to understand it. If we were in class like normal, we'd be able to go through this stuff, but we're just dealing with it right now, right? Another major kind of cool aspect of the scapulothoracic joint is that because it's not bone to bone, it's largely just supported by musculature, right? So there's no ligamentous support. We're not tying the scapula into the axial skeleton. We're just simply supporting it with other muscles. So that's why you can run into things like winging scapulas or scapular dyskinesis, or you can have poor scapular movement. It's because there's not a ton there's really no ligamentous support going on here. So let's talk shoulder girdle movements, right? We covered bones. That's awesome. Now let's talk about the movements that are capable at the shoulder girdle. The shoulder girdle is really any time there is scapular movement. If the scapula is moving, it's a shoulder girdle movement. If the scapula is not moving, it's a shoulder joint movement, right? So we need the shoulder girdle. In order for the shoulder girdle to be moving, we have to have scapular movement. So wherever the scapula is going, the clavicle is going to be, the sternoclavicular joint is going to be articulating, and the acromioclavicular joint is going to be moving as well, right? So the SC joint and the AC joint are going to be adjusting anytime that scapula is moving. So again, key features over here on the right hand side of the slide, we have a clavicle, we're going to have our sternum, the manubrium of the sternum right here, our AC joint, so we're going to have our acromioclavicular joint here, sternoclavicular joint here. Flip it to the other side, acromioclavicular joint, spine of the scapula, you can kind of see how it's running right here. And you're going to have the inferior angle of the scapula down here. So when it comes to abduction or adduction, it's a little bit different than it is with humerus, right? This is humeral or shoulder joint abduction, adduction. When it comes to scapula, what we're doing is we're abducting away from the vertebral line, away from the spinal column, or we're moving a deduction closer towards the spinal column. So I want you to think about it is a protraction for a abduction, it is a retraction for a deduction. How many of you guys have ever been on a low row or a cable machine and you feel your shoulders get pulled forward? So that is going to be shoulder abduction or protraction, this position where you're allowing your scapula to rotate out and away or move out and away from that vertebral column. Now, if you've ever set your shoulders or set your back or set your shoulder blades on a bench press and actually tried to bench off of a platform like you're supposed to, that motion of bringing your shoulders back together, shoulder blades back and in, is going to be a deduction or adduction because you're bringing the shoulder blades back towards the midline. So what about downward rotation or upward rotation of the scapula? So I want you guys to really watch and pay attention to that medial border. You can watch as she gets up to the top, you can see that medial border and that inferior angle coming back down. So she's starting at the top and we're rotating back towards the midline. So we're actually rotating that scapula back downward. Now, on the bottom side, you're seeing the opposite. You're seeing her allow her shoulder to go into abduction, so that shoulder joint's abducting, and you can see that inferior angle in the medial border of the scapula are actually rotating outward. They're actually rotating outward and upward. So because we're moving that shoulder or that scapula in this direction, that is an upward rotation. Whereas the image above, the GIF above, we're rotating that scapula back down from an overhead position, or that inferior angle and that medial border are rotating back towards their normal start point. Scapular depression and scapular elevation largely just revolve around the shrugging up motion. So in depression, you're starting at the top and you're pressing those shoulder blades, those scapulas back down, right? You're allowing the scapula to come back down. You're forcing it back down. So it's sliding down the axial skeleton. Now on shoulder elevation, scapular elevation, you're shrugging up and you're allowing that scapula to raise up along the back, up along the ribs and the axial skeleton, right? So scapular depression and elevation are shrugging motions. Downward rotation and upward rotation, we're paying attention to the inferior angle in that medial border. So we're rotating that medial border down, back towards the spinal column. We're moving that inferior angle back down towards the spinal column. We're rotating that inferior angle, that medial border, up towards the sky. Something that I want you guys to pay attention to is that because the shoulder girdle is scapular motion and scapular movement, it's not necessarily relying on the shoulder joint or its muscles. It's the shoulder girdle is in reference to scapular movements. So you can actually isolate scapular movement without having shoulder joint movements at the same time, right? Like we don't have to have the humerus move in order to get scapular movement. So a kind of a cool way to visualize some of these shoulder girdle versus shoulder joint movements is I want you to imagine that you were to be placing your hand on someone's scapula as they were executing an abduction movement, right? On the front, on the very first part, on the first 90 degrees, you would have your hand on their scapula and you would feel as they were moving up to about 90 degrees that their scapula is really not moving. Once they kind of get up and above that 90 degrees and they're moving closer to 180 degrees or can complete abduction, you're going to feel where that scapula is actually going to be rotating around. So with that, the shoulder girdle muscles and the muscles surrounding the scapula are really a stabilizing force. So they're providing a stable platform for which the shoulder joint muscles, the muscles that are going to be controlling the humerus, are going to be able to actually manipulate the humerus. Because if the scapula was constantly moving, then you wouldn't have the ability for the humerus to move in the way that it does. Because it would, if the scapula rotated at the same time that you were moving the humerus, then you wouldn't have as much net movement of the humerus. You would actually have a like concomitant movement that would actually minimize the shoulder extremity range of motion, if you will. Most of the kind of movements and concepts that we've talked about have largely been around the scapula moving in this kind of rotational manner or in this elevation and depression manner. But there are definitely movements where you're going to have an internal or external rotation about the SC joint and about the AC joint that's going to actually manipulate the scapula in an internal or external rotation movement. So one of these things, like a good way to see this is actually in a winged scapula position, right? So if you go through high levels of internal rotation, you can actually see where that scapula will wing out. So again, this is the right hand side and this is the left hand side. So if this is the sternum, then this is where the humerus would be. If you put your hand on your shoulder, on your AC joint, and now allow your clavicle to come forward, almost like you're protracting, and you feel how, as you're moving forward, your clavicles is moving anteriorly, that 15 degrees or so. Now I want you to take and place your hand on your scapula, and you can actually feel that your scapula is going to wing out from your axial skeleton. You actually force that winging out. Another really good way to do this is to actually take and put the back of your hand on the middle of your back and try to open up your chest, and you'll feel that your scapula will wing out. So that's what's going to be occurring with this extreme internal rotation, and you can see that scapula is actually going to wing out. The complete opposite is going to occur with an external rotation. You're going to have this like inward tilting of the scapula. Another movement that can occur at the scapula is actually going to be anterior tilting or posterior tilting. So you can have a rotational movement of the scapula within the frontal axis, the frontal axis sagittal plane. You can actually move that scapula top forwards and go into an anterior tilt position. Or you can go into a posterior tilt position. So if I rotate there, you can go into an anterior or a posterior tilt position. So that would be that the superior border is moving antero-inferior. So it's moving from top down. And the inferior angle is moving up, out and up, back and up, right? The posterior tilt is going to be where you have the superior angle rotating back, and you're going to have the inferior angle rotating forward. So the superior border moving postero-inferior, so it's moving back and down, right? Because it's rotating, so it's back and down. And then the inferior angle is moving antero-superior, so it's moving forward and up. And the reason it's moving back and down or forward and up is because it's rotating about the frontal axis, or it's moving in the sagittal plane, right? Imagine, because we're viewing this in a sagittal view right now, glenoid fossa, anterior, posterior. You can see that you would move the superior border postero-inferior if you're going backwards in posterior tilt, or if you're going in anterior tilt, you'd actually be moving that superior border antero-inferior. So that would be forward and down because it's rotating. Remember, like this is our point of axis. This is our axis of rotation right here, and that's our frontal axis. Posterior tilt, it's kind of hard to see or hard to imagine what this would look like. Anterior tilt versus posterior tilt. Great example of anterior tilt is kyphosis. Whenever we did that game, you guys all nailed kyphosis. So imagine kyphosis, that is an anterior tilt of the scapula. The scapula is actually rotating, that superior border is rotating antero-inferior. So it's moving forward and down. In posterior tilt, you're trying to actually rotate that scapula the opposite direction. So that inferior border is moving forward and that superior border is moving backwards. Next video, we're going to be talking about the muscles of the movements.